Hello, welcome to AMCI Saturday Study Session, or SSS. I'm Mrs. J, Curriculum Director here at AMCI, and I am delighted to present AMCI Lead Instructor Ms. Tamika along with her guest. Without further ado, let's get started. Take it away, Ms. Tamika.
Good morning. Good morning. How is everybody? Let me see, who do we have here today? Hello. Good morning. Good morning, Miss Michelle. All righty. That is fine. That is fine. I'm glad you will be watching, and we certainly are hopeful that you will learn something new, Miss Michelle. All righty. What about everybody else? Is everybody awake? Is everybody ready? You got your Java juice. Good morning, Giovanna, Andrea. It is always a pleasure to have you guys here. You know, I have my two special ladies here with me. I have Miss Chinwe and Miss Tina. Miss Chinwe, come and say hello to these wonderful coders this morning.
Hello, good morning, everyone. How you doing today? I hope you've had a wonderful week. Let's do this.
Yes, let's do this. And Miss Tina, come on, lady, and say hello.
Good morning, coders. Looking forward to spending the day with you today.
All righty, we are getting ready to roll, and you guys know this is a study session that we have for digestive urinary male and female. I want to see how you guys are doing. I will probably ask you just two little poll questions to see how you guys are coming along with your chunning. I don't know which one are you this morning. All right, welcome to Saturday study session. I want to say that I'm the one with the glasses, but I'm probably not quite that cool this morning. I don't know, but I do have my coffee. Somewhere in between us. I know, Andrew. It's like, I know you can't see me, but somehow I feel guilty if I'm not pulled together. Alrighty, so for our copyright, CPT copyright 2020, American Medical Association, all rights are reserved. CPC is a registered trademark of the AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept, FTR, CHUN, AMCI FAP7, FLIP, TAP are trademarks of AMCI. Sometimes scenarios. All right. So that's what you're here for. And that's what we are indeed going to do. I'm going to have Miss Tina read us out. We're going to do 2.5 minutes. But hey, if most of you get it before then, fine. But if not, just take your time and do your best. Come on, Miss Tina.
Okay, what CPT code and ICD-10 codes for a hemicolectomy performs on a patient with colon cancer? A 44140, C 189, B 44210, D 490, C 44155, C 19, and then D 44213, and D 49.0. You have 2.5 minutes.
All right, coders, that is your time. I'm going to give you a few more seconds to get some answers in here. What I'm seeing, I like. I like it. I like it. I like it. You guys are doing an amazing job. An amazing job. I see you in there. Okay. I'm going to give you just a little bit longer. I want everybody to get a chance to stake their claim and get that answer in there. All right. So we're gonna go ahead and get some explaining going, okay? So if you're still solving, you can continue to work, okay? So we're gonna go ahead and walk through this, all right? So your answer is indeed, it is A. And many of you, everybody that has answered, you guys have said A. And I'm loving it. I see you, Renita, Janetta, and Robin, and Andrea, Fatima, Dana, Erica, Tamika. You guys are doing outstanding. I see you too, Miss Regina. All righty, so let's take a look. You guys already know how we got there. So we've got the hemicolectomy and performed on the patient with colon cancer. All righty, so obviously you guys already took a look and right away, what are you guys going to eliminate right away? Because we're looking at these codes, and granted we're going to use the CPT codes to drive it, but looking at the fact that the patient has been diagnosed with colon cancer, what would you go ahead and say, I'm done with that, I'm done with that, I'm going to get rid of it? Yeah, that's right. You're going to eliminate the B and the D simply because of this. Although these codes are going to drive it, but you're eliminating this because remember, when you look on site, a cancer code would begin with a C. Okay, so that already lets you know that B and D will be out of there. But we're going to do our due diligence though and take a look at what we have. Okay, we do have the hemicolectomy. Just gonna point out to you so that when you are looking, remember that hemi means half, and so the hemicolectomy means that we have half or a partial colectomy. And yes, someone else also said, yeah, that 44213, that's got to go because that is an add-on code and that would not be sequenced first. Okay, all righty, so we're then going to move on and take a look at then code 44155. That is a total colectomy. And we already said, looking here, this word right here, it has a story to tell. And it's saying, hey, we only did half. We don't need a total. So that one's gone. And you guys, hey, you already knew that. All right. So you guys knew, take that thing off. All righty. We're going to go on to our next one. We got the 44202. That is the parent. But the dependent is what we are looking for, and that is the 44210. And remember what I was telling you last week, one thing, once the common code language for this parent, if it is incorrect, then the dependents would be incorrect as well. Okay, so even though we have to look here and then down here to find this code, because this common language is what's incorrect, everything that falls underneath would be incorrect as well, because everything under this full code would be laparoscopic surgical colectomy total, and so it's wrong on a whole lot of fronts. So that one is gone. Alrighty, so we already are left with the A. Alrighty, oh, there we go. So we're left with A, and then we're gonna go on and we double check ourselves. What does that 44140 colectomy partial? That's exactly what we need, and we love it. We love it. And we're going to take a look at that ICD-10 CM code, and indeed the C18.9 is a malignant neoplasm of the colon code, and so you guys already knew that, and you got it. I like it. I like it. You guys were thinking it through and did amazing. We're going to keep on moving because I want to get through as many of these as we can. And I'm going to have Ms. Chinwe come and read us out for our next one. Just a little note here. I wanted to remind you guys to be aware of where you are in that code book, okay? Because this procedure, in fact, for the colectomy partial is an open procedure. And a lot of the other codes were a laparoscopic procedure. So again, be aware of where you are, particularly when you are coding digestive, because the code series, the code family can run pages. So be aware, am I in the excision section, which would be an open procedure, or are we dealing with a laparoscopy for a scope? Okay, so does that make sense to everybody? You guys already knew that based on your answer, but I want you to just kind of tuck that back in your head for going forward. Be sure that you are where you should be, because you could have the proper code but the wrong section. And oftentimes your parenthetical guidelines, it will direct you to, because you see it's telling you here, hey, just be aware, if this is a laparoscopic procedure, this is where you should be. But it wasn't, so we're right where we need to be. All right, so now we're going to move on. All right, Miss Chinway, if you read us out with this one, I'd appreciate it, lady.
All right, thank you. And so the answers are A, 44960, 47562, B, 47562, C, 47562, 4497051, D, 47562, 4497059. What CPD codes is or are reported when a physician makes two separate incisions to perform a laparoscopic appendectomy and laparoscopic cholecystectomy? And you have 2.5 minutes. Thank you.
All right, how are we doing, coders? How are we doing? All righty. All right. I'm seeing some good answers in here. I'm seeing a little bit of a split, but we're going to we're gonna bring you guys together, okay? And I understand the split, okay? So we're gonna take care of that. Your answer is in fact D, okay? And I'm gonna tell you why. Alrighty, so we have physician takes 2 separate incisions, perform a laparoscopic appendectomy and a laparoscopic cholecystectomy. Okay, so we're going to take a look here. This appendectomy, I'm going to start there with code 44950, and we're going to take a look here at this dependent code, the 44960. Okay, it's for a fixed appendix with abscess or generalized peritonitis. All right, so that one, no. First off, there's no mention of an appendix with abscess or general peritonitis, so we're going to eliminate 44960, and it is laparoscopic. Okay, and someone already had a great question asking about, hey, I want to be sure, how do we know, is incision, excision, are they both considered open? And I would say what you have to do to be sure that you're always in the right spot is follow along where you are. If you look in your book on page 307, you'll see salivary gland and ducts. It's in red. And then in blue, you have incision, excision, repair. All of these procedures are open, okay? When you see they incise something, they excise something, but I'm telling you to follow along in your book because you want to be sure, you know, that you're where you should be. Now, when you continue on, if you go to page 309, then you'll notice that there in blue, now it's letting you know, okay, now we're in endoscopic procedures. And so it is a good idea to carry that over onto the pages that follow, because those particular those different procedures run pages at a time. So you need to know that while these procedures are going page and page, that you are using a laparoscope at that time. So be aware, just always know where you are so that you know, yeah, is it an incision? And in fact, is it an incision? And because it's open, just know, pay attention to those little guideposts, okay? So in this case, we know that this is an appendectomy, but it is open, and this is a laparoscopic procedure. And so that one is eliminated, okay? So once we take that one, we're going to take a look now at code 47562. Now that is a laparoscopic procedure, surgical. I like it. There we go, laparoscopic cholecystectomy. So we're going to hold that code there, okay? So that one is common to all of these here. So let's take a look. Now we have and a laparoscopic appendectomy. So we got a code for that. All right, so that's why you guys already knew B was not the correct answer. So this is where this was the sticking point right here, okay? All righty, so we have for 47562, both of them share that. But what about this last code for the laparoscopic surgical appendectomy, okay? That is indeed our code, but now this modifier. Here we go. For modifier 51, it's for multiple procedures on the same body area. For modifier D, it is distinct procedure with separate incisions. All right, did the light bulb go off? Yeah, I know you guys like, it's C or D, but I can't make it C or D, it's C or D. So yeah, so these little things right here, I will put different little things to remind me, like at different places in my book, or just at the beginning of the digestive area of common things. But here, right there, there's that hint right there. There's that breadcrumb. 2 separate incisions. Okay, so it might be things like this that you'll want to put to remind yourself. Modifier 51, multiple procedures, same body area. Modifier 59, distinct procedures, separate incisions. Okay, and it's telling you right there, it's giving it to you. Yeah, that aha, yes. So there we go. Now you know why C is not it. Okay, it is indeed 59. Because that provider made 2 separate incisions, 2 distinct procedures. Okay, so now we got a unanimous a unanimous uniting of the minds now that everybody is aware that D is it, right? I think everybody's good. I think everybody's good. And many of you were very, very close. So I'm glad that this was a good teachable moment. So those who got C now, you know how to get to D. All right. So we're going to keep on moving to the next one. Okay. And I'm going to have Miss Chinwe come and read us out. Thank you, lady.
Right. And the answers are A, 51050552, B, 51040552, C, 51040553, and D, 51100253. The patient has significant morbid obesity and her penis has been retracted to help with dissection. The planned procedure is to place a catheter/tube to drain the bladder. It is apparent she has quite a bit of scarification from her previous surgeries and also appears to have an old sinus tract just above the symphysis. A midline incision is made following her old scar from just above the symphysis for a length of about 4 to 6 cm. The sinus tract was excised, as this was also in the midline, and carefully dissected down to the level of the fascia. It does not appear to be an actual hernia, as there are no ventral contents within it. Again, there's quite a bit of distortion from previous scarring because of the obesity, but staying in the midline, the fascia is incised just above the symphysis of a length of about 2 cm. The fat and scar is incised above the fascia more superiorly, and with palpation, mesh from a previous hernia repair is felt. This was not palpable prior to the incision because of her body habitus. The mesh was not exposed or entered. It comes down quite close to the symphysis and certainly is too close to place a suprapubic tube. There is concern the mesh may become infected with an SP tube right there. Therefore, decision to abort the procedure is made. What CPT code and modifier are reported for this service? And you have 2.5 minutes for this. Thank you.
All right, coders, you know what that means. You know what time it is. All righty, let's see if we have most of you guys answering in the chat. We're gonna give just a few more moments so that you guys can get your answers in there. I'm loving what I see. I'm loving what I see. Good job, guys. Very nice work. All righty, so we are going to go ahead and start in on it. I see everybody's getting those answers in there, getting that last little bit in there. We're gonna let y'all do it so we can let y'all know that we see you, and then we'll go ahead and jump to it. All righty. So, as many of you already said, the answer is indeed C. Okay, so let's take a look at how we got there. We had a little bit of a split on this one, but we're going to get you there so that those of you who thought that perhaps it was D, I'm going to show you why it wasn't. All righty, so we have morbid obesity, a penis that was retracted. This is a planned procedure. We placed a catheter tube to drain the bladder, made a midline incision along the old scar, and it was about 4 to 6 centimeters along the sinus tract. Okay, and the sinus tract was excised. The fascia was incised to a length of about 2 centimeters. The fat scars incised. And then we have a mesh from a previous hernia repair that's felt. And then there was concern that that mesh may be infected. Okay, and so the surgeons decided that, hey, we've got to abort this procedure. Okay, so here's the issue here. This was a planned procedure, and they are going in to place a catheter to drain the bladder, but that mesh had them concerned. So I put you a little note down here. You guys know I am a stickler for details, if you hadn't figured that out. so the cystotomy is a surgery specifically to provide drainage via a tube or catheter. So remember that when you see the S here with this one has the 2 S's, cystotomy. But a cystotomy is simply the surgical incision into the bladder. All right, this is allowing the surgeon to take a peek inside of the bladder. So one of them, the one with the S, it involves a drain or tube or catheter, and this one involves an incision into the bladder. Okay, so and you remember your med term, totomy is incision, tomy. Okay, and then this one, drainage. All right, so we're going to start with code 51040. All righty, so this is a cystotomy, and it is a cystotomy with drainage. Okay, so there we go. All right, so we had already talked about that, and indeed they are draining. They place that tube to drain the bladder. All right, so we've got that code. We're going to put a little star by that because that one looks pretty good. We're going to go ahead and take a peek at the others for 51050. That's a cystolithotomy, and we don't have any mention of that. Okay, so yeah, let's get that one out of there. We got work to do in 2.5 minutes to get it done. So we're going to continue on now and take a look here. We have aspiration of the bladder. That is indeed the parent, but remember what I said about this common code language. Anything before that semicolon, that's the common language. It applies to all of this mama or daddy's dependents there. And so we already know right off the bat, before we even read what it says, that 51102 is not correct because we're not aspirating the bladder. Okay, so aspiration of the bladder with insertion of a suprapubic catheter. Okay, no, that one's got to go. All right, so now we're going to take a look at this modifier because we're down to the same codes, but here we go again with these modifiers. All right, so with the 52, this is for reduced services. Okay, the procedure is partly reduced or eliminated at the discretion of the physician or other qualified health professional. Okay, so this indeed is not a reduced service code. This one is, there we go. 0 on there. Remember, they were concerned about that mesh being infected, so they aborted the procedure. Okay, they didn't partially reduce it, they discontinued it. All right, and then you read what we have here for modifier 53. It is that they elect to terminate the surgical or the diagnostic procedure due to extenuating circumstances that may threaten the well-being of the patient. So it was necessary or indicated to discontinue. And indeed, their concern was an infection of the mesh. All right. So how do you feel, coders? For those of you that chose D, I can understand why you may have leaped at that one, but and you may have leaped at it because you're thinking about the 53, but the issue with that one was it was dealing with aspiration of the bladder, so it was the wrong procedure. Right modifier but incorrect procedure. So again, like I said, always pay attention to that parent code. Okay, so how is everybody? I see some goods. All right, no problem, Michelle. I'm glad you here. We still got lots of good stuff to do. So everybody's good with that modifier. Yeah, you look. I've done that too. We need to leave at that wrong answer. I'm like, I'm good right there. That modifier, I got it. But pay attention to what that thing is attached to. Okay. All righty. So we're gonna keep on going. We're gonna move along with yet another one, and I'm gonna have Miss Tina come and read us out. Thank you, lady.
Okay, we'll start with the answers. A, 49561 with a diagnosis of K 40.90. B, 49566, K 43.0. C, 49556, 49568, and K 43.0. D is 49561, 49568, and K 43.1. A 42-year-old patient is brought to the operating room for a repair of a recurrent incrated incisional hernia using mesh. What CPT code and ICD-10 code is reported? You have 2.5 minutes and your time starts.
All right, you guys know what that means. I'm going to give you guys a little bit more time. I think most of you have slid your answers in there just like the coding pros you are. All right, so we're going to see how we got there. Most of you have already shown us that you know how we got there. All righty, so we're gonna go ahead and unpack this thing. All right, so the answer is indeed C. Okay. And we have a 42-year-old, okay, brought to the operating room for repair, recurrent incarcerated incisional hernia using mesh. All right. All right. How did we get there? So we're going to start out here with code 49561. But we're going to take note of the fact that it is indeed recurrent, and this is an initial repair. So although it is coding for initial incarcerated or strangulated, but the fact that it's initial, right off the bat, nope, that won't do. So we're gonna take that one away. All righty, so that's nice. Look at there. We got a BOGO, y'all. We got a 2 for 1. We'll take it. We already at 50%, and we are still within the first minute. That's what I like. All righty, now these two, we know we're repairing for recurrent. All righty, and we already know with the 49666 that it is incarcerated or strangulated. Okay, so with the exception of some incisional hernias, the use of mesh is often not reported separately, but for some they are. Okay, with the exception of the 49560 through 49566, which is this one. And in your book, what I did was to put just like on the side of those right there that, look here, these, I put that the mesh is not, that it's not bundled, and then put that this is the code you need to use, so that way it keeps you straight. Okay, so we're gonna take a look. It is recurrent, it is incisional, and we talked about that. Recurrent, it is incisional. There are those keywords that you need. Okay, and so there we go. And it's incarcerated. Okay, there we go. Now we got to take a look. That's within that range. There it is right there, 49566. Okay, so that lets us know what about that when we see this particular group of codes. Again, it's just this little, they're like a special little group, they're a club. Okay, yeah, you gotta put next to these that mesh is not bundled in these, so you're gonna need a separate code for that. Okay, and they're telling you what that separate code in fact is. Okay, and that is, we're going to need to add that 49568. Okay, the implantation of the mesh. All right, for the incisional or ventral hernia repair or mesh for closure. All righty, so we're going to use that in conjunction with this 49566. All right, it's giving it to you right there. Okay, so definitely those parenthetical guidelines. Yeah, any other case, like again, don't jump at it. Don't jump at it too soon. And then we are just verifying that indeed that is a ventral hernia. But you guys already know that when you are coding on this exam, you're not looking up these ICD-10 CM codes unless you need to break a tie. In this case, you're not even going to touch it. Okay, not even gonna touch it. So here was the takeaway from this one is that certain ones, the mesh is not included. So make note, this is a special little club right there. Okay, so we've got the incisional hernia, got a code for that mesh, and then we already looked at the diagnosis, but this is the main thing. For this particular code, that mesh is not included. You got to bring in 49568, that add-on code, to make it all work. Okay, all right, so how we doing, guys? Okay, I think most of you were there, but we had somewhat of a split. Some people were really close, and this is the place to really get those little fine details. Okay, that's what forensic coding is. It's like plucking that little needle in a haystack, plucking that thing out of there and finding the needle. Okay. All right. So I'm glad everybody's doing good. I see you guys in there. You're hanging in there. And we are going to continue on. And I'm going to have Miss Chinwe come and read us out. Thank you, ladies.
All right. And so the answers are A, 43754, R40.2, T42.71XA, B, 43753, T42.4X1A, R40.20, C, 43756, T42.71XA, D, 43755, T43.501A. A 4-year-old patient who accidentally ingests Valium found in his mother's purse is found unconscious and rushed to the ED. The child is treated by the ED physician who inserted a tube orally into the stomach and performed a gastric lavage, removing the stomach contents. What CPT and ICD-10 CM codes are reported? Thank you.
All right, coders. I think from looking at the chat and answers are coming in, I think we are about at the time limit, if not just a little over. But hey, that gave everybody time to get these wonderful answers in here. And I tell you, you guys are on fire. Simply outstanding. To quote Mrs. J, simply outstanding. We're going to quickly run through this one because I didn't see not one person need a little nudge on this one, okay? So you guys already know why it's B, okay? This 4-year-old has accidentally ingested some Valium. They're unconscious, and the ED physician is going to insert a tube orally into the stomach and perform gastric lavage, removing those stomach contents. We are starting out with code 43754, and this is a diagnostic procedure. And in fact, this procedure was therapeutic. He's not going in there to diagnose anything. We've got an emergency. It's therapeutic in that they are going to really rinse out or lavage those contents in the stomach. So 43754 is going away. So we have 43755 still under the same code family. And for this one, again, because it is part of this family, if the well, not because it's part of the family, but because the code language, the common code language is incorrect, then everything that follows beneath it as a dependent would be incorrect. And so 43755, that's off the table. Not to mention there was no collection of multiple fractional specimens. All right, so we move on down to 43756, and that's a duodenal intubation and aspiration diagnostic. And this was gastric for starters, not duodenal. And again, this was not a diagnostic procedure. It was in fact therapeutic, so it could only be 43753 for gastric intubation and aspiration or aspirations therapeutic, including lavage. And we got all of that good stuff right there. And so those keywords, it drives you to the correct answer, and that it did for all of you. And B is your answer. And we are going to do one more in GI. Alrighty, so here we have the last code, accidentally ingest, and the main takeaway here is understanding the 7th characters for certain codes. We have the T4 2.4x1, which is the poisoning by benzodiazepines, accidental or unintentional, and we see that in the scenario accidentally ingest Valium. So we know we're in the right spot, but this red box tells us we need a 7th character, and so we're going to go up. There we go, the pink box right above. We know that was the initial encounter, and so that one is correct there. And then for the coma, unspecified, and indeed it gives us here unconsciousness. Okay, and so there we go. They were found unconscious. We know we're in the right spot with that code for R40.20, and so B, as all of you so eloquently have done in the chat, everybody said B, and I think that is amazing. All righty, so we're gonna go ahead and do this one. Miss Chinwe, I'm gonna have you read out, and then Miss Tina will start us with our next section when we go into urinary. Thank you so much, Miss Chinwe.
Oops. Thank you. And the answers are A, 490058, B, 490077, C, 4940277, and D, 4940278. Margaret has a cholecystolithotomy with a rule on Y. 5 hours later, she had an enormous amount of pain, abdominal swelling, and a spike in her temperature. She is returned to the OR for an exploratory laparotomy and subsequent removal of a sponge that remained behind from surgery earlier that day. The area had become inflamed and was demonstrating early signs of peritonitis. What is the correct coding for the subsequent services on this date of service? The same surgeon took her back to the OR as the one who performed, is the same one who performed the original operation. What CPT code is reported? Thank you.
All right, coders, that is time. How we doing? How we doing? All right, I'm seeing lots of good stuff. Lots of good stuff. All right. All right, so we're going to go ahead and unpack it. And then before we leave this section, I'm going to answer a question that somebody asked in the chat that I think it would be a good talking point for all of you, okay? All righty, so for our answer, we have D. All right, and I don't think it was a surprise for many of you, but we had a few takers with A, and we're going to show you why it was in fact D. All right, so we have the um, cholecystoenterostomy with a Roux Y. And then they are returned to the OR for an exploratory laparotomy, subsequent removal of a sponge that remained behind from the surgery that was earlier that day. And then we're going to code for subsequent services on this date of service. Same surgeon, okay, that took her back to the ER was the one who performed the original operation. So we are starting here. We're going to code for that subsequent service, okay? And so what was the subsequent service that happened, okay? The subsequent service was what? We are removing that sponge, okay? Every now and again, they leave something behind, okay? So there we go. The subsequent service, they were moving that sponge. That's right, Andrea and Janita. Yes, they are removing the sponge. So for 49000, it's exploratory laparotomy, but it's exploratory ciliatotomy with or without biopsies, separate procedures. Okay, so we didn't have this going on. All right, so they are exploring, but we didn't have the latter part of that code going on. So we got to read all the way through. So that's why code 49000, that's why that one's incorrect. Okay, so as soon as your eye picks up this, but you got to keep reading. So it's fine when you chun to like do this because it does, that leads you to believe I need to look a little further because it is exploratory, but now we got to continue on to determine, okay, I need to look, but now let me really get forensic. What else does it say? Okay, so it's good to help narrow it down as opposed to thumbing through everything. But once you hit this, you got to read further, and that's when, okay, no, we can't do that. All right, because the biopsy is a with or without. That was one thing that I had to get accustomed to as a student. The with or without, that's applying to the biopsy or biopsies. But the exploratory laparotomy, exploratory ciliatotomy, that's got to be there, okay, with this particular code, okay? All right, so we're coding for that subsequent removal. So we look at code 49402, and both C and D share that code. And so indeed, it's what we need. It's for the removal of the peritoneal foreign body from the peritoneal cavity. All righty, so that foreign body is that sponge, but the sticking point, that modifier, that 77, it is indeed a repeat procedure. But one thing about it, it's from another physician, okay? And the same surgeon that performed the original procedure took her back. So that would make modifier 77 incorrect. And so indeed, 78 is the modifier. Not only is it the same physician, it could be the same or another provider, but this makes it doubly correct because not only is it the same physician, but it is an unplanned procedure. He had no intention of going back in there to remove a sponge. That was unplanned, but he had to. And so that's why 49402 with the 78 modifier is your correct answer and the correct modifier. All right, I think everybody's feeling good on this one. And for those who kind of deviated just a bit, how you feeling on that? I think this probably, you hit that, and again, you're going so fast through those codes. Once you see the keywords that you need, be sure you read it in its entirety to be clear that the entire code language is what you need. All right, good to know. I got some guidance. Perfect. All righty, so we are going to keep on moving. We're going to switch gears just a little bit. So for just a split second, you won't see anything on my screen because I'm going to get us down into some urinary stuff. Okay, so I'm going to get down here and we will start doing some more stuff. I had some more GI stuff, but we can't spend all our day in there. We gotta get moving with some stuff with urinary male and female. So that we shall do. And I'm gonna get us on this page. Let's see which one we're gonna start with here. There we go. All right. All righty. So here we go. We are back. And Miss Tina, if you could read us out, I would love it, love it, love it, lady. Thank you.
Okay, we'll start with the answers. A, 54400. B, 54416. C, 54408. D, 54401. Patient is status post radical retropubic prostatectomy with I'm having trouble with that word. I'm sorry. Dysfunction and presents with a penile implant. I'm sorry, I'm screwing this up a little bit. An inflatable penis, penile prosthesis is inserted. What CPT code is reported for this service? And your time's
All righty, you guys know what that means. You know what that means. All righty, we got a lot of good stuff going on in that chat. Thank you, Miss Tina, for a job well done. Look here, my tongue gets the best of me at times too. Wonderful job. All right, coders, we are ready to do this thing. The answer is in fact D. Okay, we're gonna go ahead and take a peek at this thing and see why. All right, we have the penile implant. An inflatable penile prosthesis is inserted. So how did we get here? All right, looking at code 54400, insertion of penile prosthesis. This one, in fact, is non-inflatable. Okay, and this one is inflatable. So we're going to take 54400. That's no good. Go ahead, get out of here. All righty. So we also have code 54401 in this code family. And hey, in this case, we got to take a look at this parent's dependence, because insertion of the penile prosthesis, that is correct coding. That's the correct code language we need. Again, it's before that semicolon. And I know I keep saying that over and over again, but sometimes it's just good to just have it in your head, to just for that to be secondary to you, second nature, so that you know, hey, I'm in the right spot. That's good. So let's see what it has to offer. Well, in fact, it has the inflatable penile prosthesis up under that dependent code. And yeah, that's a good one. All right, so we're going to keep that one on the table. Let's just start for a bit and take a look at 54408, and that is repair. Okay, and we are having what? An insertion done. All right, so we're not in the right spot for that one. So that one, yeah, that's got to go. Let's do our due diligence and take a look at code 54416. This is removal and replacement. And what? We are inserting the implant. And so 54416, that one's got to go too. It's out of here. And indeed, as many of you have deduced, that 54401 is your code. All right. And so we see that with B, that wouldn't be it. We had a few takers on that one. That's for removal and replacement. Okay. This one is being inserted. All right, so here the keywords don't match, and this would imply that they had one. Just from what we're seeing, they're just talking about it being inserted. So remember, we're only coding what we see. All right, and according to this scenario, it's only being inserted, and therefore we got to take code 54401. All right, how we doing? How we doing, coders? How you doing? Everybody, have you had your first good cup of water or coffee? Or all right, so I think you guys are doing fantastic. We're going to keep it moving. We got to get some more urinary stuff done. I'm going to have Miss Chinwei come and read us out on our next scenario. Thank you, lady.
All right. And the answers are A, 55873 C61, B, 55873 C79.82, C, 55873 D, 07.5, and D, 55875 C61. Cryo-surgical ablation of the prostate is performed for prostate cancer. What CPT and ICD-10 CM codes are reported for this service? Thank you.
All right, we are getting close to time, and I see many of you are getting it in there. Lots of good answers in there. All righty. Somebody said they were going to get their coffee and they were doing okay until I mentioned it. Look, now I'm over here thinking I need to rewarm a cup. All righty, so we are going to go ahead and unpack this. Many of you got it. We had a few though that felt like, yeah, I'm thinking that C is possibly a go, and hey, that's all right. We're going to show you why it's not. So first off, I'm going to show you a shortcut with that C anyway. The answer is A. But one of the things we're going to do is start out with our keywords. We have a cryosurgical ablation of the prostate for prostate cancer. Now, again, we always use our CPT codes. We want to stay in that book pretty much 99% of the time while we're on this exam because it is driven by those codes. But every now and again, you get kind of like a freebie in there. Because this is prostate cancer, remember with those ICD-10 codes, you can notice certain ones by sight, and one of them is this D07.5. How you're saying, well, why would I know that? Well, everything with the C we know is going to be related to cancer. We don't have to specifically know what cancer. We're not memorizing codes like that, but we are becoming more familiar with code families. And so this patient had prostate cancer, so we could immediately take C away. Okay, so here we go. We're going to start out with 55873, and all of these codes share it. Okay, all of those share it. So with that one, they are talking about the cryosurgical ablation of the prostate, and check, we see that right there in that scenario. So that 55873, yeah, that's a good one, but you guys already know. Why did I take this one off right away? All right, I think you guys already know. Did you guys see that right away? Again, you don't allow the ICD-10 codes to drive it, but there are certain cases like this. You're like, let me go ahead and get rid of that one right there because I do know this patient has prostate cancer. Okay, so for code 55875, all right, that's our Lone Ranger sitting out there. Let's see what he has to say. Why is he not in the collective group? He's talking about a transperineal placement of needles or catheters. What? You just talking all kinds of stuff that it is not saying in this scenario. So we're going to bid adieu to him. We're going to take him away. We'll go ahead and check out what we have with our ICD-10 CM codes now, because now we got to break the tie because these are the same codes. So let's take a look for C79.8. This is secondary malignancy, okay? Secondary malignant neoplasm of genital organs. This is not secondary cancer, okay? This is carcinoma in situ of the prostate. So we have D07.5. That's why that one was not correct, because they're talking about carcinoma in situ. All right, and this patient has prostate cancer. Okay, so that's why that one wouldn't go. But here we go. C61, malignant neoplasm of the prostate. Yeah, that's exactly what this patient has. And so here we go with A, 55873, and C, 61. Yeah, the carcinoma in situ. Yeah, that is not cancer. It's not just like malignant neoplasm of the prostate. The in situ is that it is contained. It's severe dysplasia. Another way you can do is you look at some of the examples that they give you under it. Okay, severe dysplasia of the prostate, prosthetic, intraperitoneal neoplasia, and then they're giving you the different stages. So again, if it didn't say it, if it didn't say it in the scenario, then it didn't happen, or it's not the diagnosis. So in this case, it's just simply prostate cancer. They don't say anything about carcinoma in situ. They would have to say that, and yeah, it would have to be stated. Yep, that's right. It would have to be stated. Okay. Another thing that I do, just as a, if you're on the exam and you get to this point and you come here, and if you are toying with it, what you can do, and I did it for a couple of mine on the exam when I took it, was if I was like, I just want to be sure. I just went back because you'll have time. You're going to be eliminating pretty quickly, but just go back and start in the alpha index and just look up prostate cancer. And then that way, when you get there, then you just know that you know. If you're going back and forth, and you're like, I don't know about that, D. Just look up prostate cancer. Okay, that's when you get down to here. Don't start here. But this is for if you are breaking the tie and you just want to be sure that you know, just flip back real quick. This will be quick to look up. It's not going to be anything involved, but don't depend on it. But if you get here and this still you're not convinced because of the wording, just go back to that alpha index so that you're sure. Okay. All right. Okay. So we'll keep on going. And let's take another look at some more codes. All right, Miss Tina, you are up, lady. You are on deck.
Okay, we'll start with the answers. A, 52648, 52204, 5 or B, 52647, C, 52649, 52224, modifier 59, and D, 52648, 52224, modifier 59. Pre-op and post-op diagnosis is cystologic atopy and gross hematuria, cystoscopy, and random bladder biopsies, and green light laser ablation for the prostate. Description: bladder biopsies were taken from the dome, posterior bladder wall, and lateral side walls. Bugby was used to dilatate the biopsy sites and diminish bleeding. Cystoscopy was placed with a cystoscope designed for the green light laser. We introduced this into the patient's urethra and performed a green light laser ablation for the prostate down to the level of the veramotenum on the prosthetic chest near the wall of the urethra. There were some clarifications that the lift apex for the prostate caused damage to the laser, but adequately vaporization was achieved. What CPT codes are reported for this service? You have 2.5
All right. I'm seeing everybody's getting those answers in the chat. We have a little bit of a split on this one, but hey, no worries, no worries. I got you. Let me be clear about two things I want to clarify, because I don't want to wait to the end and then I forget. Okay, so the easiest way to remember in situ, okay, the word in situ, it means in its original place. And so when you have in situ cells, they're not malignant or cancerous. However, they can sometimes become cancerous. Okay, so does that help it? All right, so I wanted to be clear about that. When you see that in situ, it means those abnormal looking cells are kind of funny looking, but they're in the place that they originated. They're not malignant or cancerous. They're just kind of they're just in between, but they could be. Okay, so that's why that would be a no, no. Okay. Somebody else had asked me about um, the words excision, resection. And like I was emphasizing to you guys, make sure when you're in the digestive system or anywhere in this book, because you have laparoscopic and open procedures in all of the different body areas. That's why you want to pay attention to your headers, things that are in red, things that are in blue, and then you'll know when you've gotten into the laparoscopic section. But I had a great question someone asked. So, hey, what if it's a resection or an excision? Could that be laparoscopic? I want you guys to look. I know we've moved on to urinary, but look on page 311 in the digestive area. You'll see that we're in the laparoscopic section. But if you notice, when you go down to code 43211, that is indeed an endoscopic exam, flexible, transoral, but it's with an endoscopic mucosal resection. So even though they're going in with a scope, you can resect things out. Okay, so that's why I said just pay attention to where you are. I am going back. Yeah, I was going back, going to differentiate. Yeah, those different procedures. Okay, so yeah. All right, so that's why I was telling you guys go back to that. I didn't want to forget, because some questions I'm answering you guys in the chat, and then others, if I feel like it would be a moment of clarity or further clarity for others, that's why I wanted to touch on that. Okay. All right. So are you good, Miss Fatima? Now, it has nothing to do with this one. That's what I was talking about. All right. So here we go. We're gonna dive into this one. And the answer is D. Okay. Yeah, this one, you guys were split on this one. So no worries. I got you. All right. So I'm here to help you guys get clear. So we had the cytologic atypia and gross hematuria. We had a cystoscopy with random bladder biopsies, and we had this green light laser ablation of the prostate. We had these bladder biopsies that were taken of the dome of the posterior bladder wall, the lateral side walls. We had the Bugby used to fulgurate the biopsy sites. Okay, and then we had the cystoscope, and that was replaced with another cystoscope that was designed for the green light laser. And then we had it was introduced into the urethra, again, the green light laser ablation of the prostate, and then the near the wall of the urethra, we were ablating some tissue and things, and then we had some calcifications at the left apex of the prostate, and then they were vaporized. Okay. All right, so here we go. Yeah, I got some folks sliding in here, and folks are torn between A and D. All right, so let's see why. We have code 52647. This is laser coagulation of the prostate. Well, none of that was mentioned. Okay, when you go through and you're looking, we see a lot of things about laser ablation. We see vaporization, but we don't see anything about laser coagulation. We are talking laser vaporization here. And so we're going to take that code 52647, and yeah, let's get him out. He's out of here. All righty, let's take a look now at code 42648. This is laser vaporization of the prostate. Okay, I like that code. I like that code. Let's just unpack it a bit with that vaporization. We see we have the ablation going on, a whole lot of things going on when that scope is placed through the urethra and then up into the bladder dome. All right, so we're going to take a look here. We're going to hold that thought and just explore code 52649 to see if it's a player, but this is laser enucleation. And again, none of that happened. Again, laser vaporization, not enucleation. So we're going to go ahead and take that one away. So we've got it narrowed down. Okay. All right. So with the cystoscopy, and you already ahead of me, Janetta, with the cystoscopy, we are looking cysto, we are looking at the bladder. Okay. When we start talking about cystourethroscopy, I know you're like, well, how did we get that? Well, then we are talking about going through the urethra. And if you notice down here, we have that it was introduced into the patient's urethra. Okay, so that's how we got cysto, because we're going into the bladder, but we're going through, we got to get in there, and this is by a scope. And so they chose the route of going through the prostate. In this case, they're going through the urethra, then they entered through the penis and up through the urethra into the bladder, which would make sense because all of the anatomically, all of those things are there together. Okay, so that makes sense how we got to a cystourethroscopy. It's describing the route. They went through the urethra and it's saying they're into the bladder and they're using a scope. Okay, so we're going to then take a look here at these codes here and differentiate which of the two is correct. All right, so you guys were torn between here. So you got here, this is where we had the fork in the road. So for 52204, that is a cystourethroscopy with biopsies. Okay, and I know you're like, well, hey, they said something about some biopsies, and yes, they did. But we have a more specific code. So that's why you got to explore all of them, okay? Because remember, when you're coding, you want to code to provider specificity, okay? So you want to be as specific as possible. You want to code to provider certainty and specificity. So we're going to take 52204 off because we've got something else. Look at there. Yeah, cystourethroscopy. That one said with biopsy, but what were we talking about here? Fulguration as well. Okay, yeah, right there. Fulguration, and we address those biopsies. This is with or without. Okay, so don't get caught up. That's a game changer there. They did have biopsy. So this full code would be cystourethroscopy with fulguration with biopsy. Okay, so that, yeah, I see some guidance in there now. All righty, so there we go. We had the fulguration, we had the biopsies. What about that modifier? Yes, that is a distinct procedure. Okay, so because we had two very distinct things going on. We are in the bladder and doing biopsies and fulgurating some things, and then we're in the prostate doing some vaporization. Okay, so that's how we got to D. All righty, so how we doing? Let me hear. Let me see a Y for yes. You do it all right, or N for no. But how you doing? Okay, I see one Y. I got one person that's doing okay. Yes, all right. All righty. There we go. Okay. Good. Yeah, you focus on the laser cryosurgery. Yep. And a lot of times once you hone in on one, then when you can narrow it down, and you guys did, then here is where the rubber met the road. But if you look through both and you start even just looking at keywords, this one didn't have as many keywords as that one did. Okay, yeah, that one was a thinker. So definitely always look through word for word, like what's making this different. Boom, there it is. Boom, there it is. See, this one has got that and that. Again, this one is more specific. Okay, all righty. So we're going to keep on rolling. All right, Miss J, let's do it, lady.
All right. And so the answers are A, 54150, B, 54160, C, 54150, 52, and D, 54160, 52. A clamp circumcision is performed without dorsal block on a newborn. What CPT code is reported for this service?
Lots and lots of good stuff. All righty. I don't think you guys need much help on this one. I'm seeing a whole lot of good, correct answers on this one. All right, we have the clamp circumcision performed without a dorsal block on a newborn, and as many of you already placed in the chat, it is C. All righty, so I'm gonna take a look here. I like when we just have two codes that we are getting down to. All righty. Somebody said I didn't even have to look down at my FTRs. So I know you start coding sometimes. You're like, I got this, I got this. So we indeed had this circumcision using a clamp. All righty. And so we see that right there. I mean, almost verbatim clamp circumcision. So we already know code 54150. Yeah, that's going to be a good one. But we got to pay attention to these parenthetical guidelines. And that's with any code language, but especially with this clamp circumcision. Okay, so with that one, we have a do not report modifier 63 in conjunction with 54150. And some of you might be saying, hey, what is that modifier 63? You guys remember it is for an infant less than 4 kilograms. Okay, so we also take a look at code modifier 52 when we are dealing with code 54150. We would do a modifier 52 when performed without dorsal, penile, or ring block. And in this case, yes, it is without that. So we already know we're going to need that modifier. And with that said, yeah, we're going to take away that one because it doesn't have the modifier. Okay, so we're going to take a look, do our due diligence. What does 54160 have to offer? Well, in fact, this one is a surgical excision other than a clamp. Well, we already know we use the clamp. So I guess it's saying, look, you got to choose one or the other, which you do. Alrighty, so code 54160, because indeed this was one using a clamp. This is one for surgical, so we're going to take off B and D. And then 54150 with the 52 modifier, that is the right code. I'm going to call this a quick chun chat. Just, if you guys have done amazing. For some reason, these two little codes used to get me. It just did. Some days I was good, some days not so much. So just quickly reminding you guys, remember that dorsal, penile, or ring block is anesthesia. Okay, so what I did now, chunning yet again and code, chunning with you guys with the 2020 book. Here you want to say that's a clamp, and it's with anesthesia, because this is with for some reason I would want to make this ring block like a clamp. For some reason that's just it's just what it seemed like to me. Okay, and then here with this parenthetical guideline, then I started putting if no anesthesia. Then yeah, I gotta look here and see what else needs to be said. This one is excision surgical. This here, less than 28 days old. Okay, and we know there's another code that goes up under here too for infant that is older than that, but we didn't need that one in this scenario. And then here with the do not with the modifier 63. And for me, this is another thing that I do with, particularly if you have a lot of parenthetical guidelines on certain pages, and definitely going back to digestive, since we're doing that too, in order to cut down on the highlighting with the parenthetical guidelines, I just start doing a little symbol, whatever works for you. I just start doing a little symbol in red, letting me know this particular parenthetical guideline is a do not, instead of, because if you highlight the whole page for something that's important, if everything's highlighted, then nothing will be important. So all right, so you guys already had that, so I hope that is helpful. We are getting close on time. Do you guys think that you could get one done quickly? We're going to do 2 minutes on this one if you want to squeeze one more in. Okay, and so we can get out of here. All right, so I'm going to read it real quick because I don't want us to get turned off. So you guys start working while I'm reading. We're going to do it that way. We have A, 52282, B, 53855, C, 52332, and D, 50605. The patient is a 53-year-old male with a benign prostatic hypertrophy causing urinary obstruction and requires the placement of a temporary urethral stent. What CPT code is reported for this service? All right, guys, do what you do. We're going to make this one 2 minutes. Oh yeah, I knew you guys would need too much time. All righty, so I think pretty much everybody got this. We had just a few takers with A, and we're gonna just quickly run through. Most of you have said B. All righty, so this patient is 53-year-old, benign prostatic hypertrophy, urinary obstruction, placement of a temporary urethral stent. That right there, that's gonna drive it. This 50605, you guys already know that's for ureterotomy for an indwelling stent. And so that one, no good. We're going to take it away. We're looking for a temporary urethral stent for code 52282. This is a cystourethroscopy with insertion of a permanent urethral stent. And that is why 52282, it's got to go. For code 52332, we have a
Thank you for watching an
cystourethroscopy with
AMCI
insertion
exclusive
of a
presentation.
urethral stent, an indwelling urethral stent. All right. We need temporary. You trying to just do an indwelling? We don't need that. That's not what it says in the scenario. So C is incorrect. B for code 53855. That's insertion of a temporary. There we go. Prosthetic urethral stent. Whoop. There we go. For temporary urethral stent, yeah, that's what we need. All right, we know it's prosthetic. It's saying right there, okay? He's having the stent because of prostatic hypertrophy, meaning that prostate, it has enlarged. So they're going to insert the stent so that he can be sure that he can get to that restroom. All righty. So, all right, how's everybody feeling? The temporary, it would be unlikely, Aisha. It would be unlikely. Usually because with the indwelling catheter, they've got to go in. It's a little bit more intensive. I suppose it could be, but in this case, we're just gonna stick to what we know. Okay. See, you code like me at times. I'm like digging in. I'm like, wait a minute, no, just code what you see. Don't start thinking about the what ifs. Okay, just drive it to the answer. It doesn't matter whether or not could that be. In this case, just looking for temporary. If it's indwelling, then it's not what we need in this case, and we're just looking for temporary. Okay, so just keep it cut and dry. All right, coders. That is like I have more stuff, but we just don't have time to get more coding in. I sure do wish that we did because you guys are always such a joy to have in class. You really, really are. You really are. And if you guys have any additional questions or anything like that, let me know and I'll try to quickly address them, or we'll do it on the next go round. So just some quick reminders to chun. So it helps to distinguish one code from another to avoid mistakes. Alrighty, refine that keyword concept. Okay, only highlight keywords relevant to your coding. Avoid flowery words. All right, always read those parenthetical guidelines. Yes, they are supreme guidelines, precedence over everything. Okay, it's kind of like how cash is king. Those parenthetical guidelines, those are king. The medical terminology, yes, strong base on medical terminology will help make you a better coder. All righty, so as always, you guys are AMCI fabulous. Thank you so much for your time and attentiveness today. Please don't forget to leave us your feedback. All righty, let us know what we can do to help make this experience even better. Ladies, would you like to come on in and say adios to these wonderful coders before we start our Saturdays?
Hi, coders. Okay.
Go ahead.
You did great today, and as the days go by, I know you're getting stronger and stronger. I wish you a wonderful weekend. Bye.
Everyone have a nice weekend. It was a great class today, and I look forward to next week.
Thank you, ladies. It is always a pleasure to have you guys here with me on the weekend. So thank you so much, Miss Tina and Miss Chinwei and class. You guys are just phenomenal. You guys have a great weekend.
Thank you for watching an AMCI exclusive presentation in partnership with AAPC. Until next time.